Scooter. Welcome to the Dr. Tom Show. Today, I'm really excited to have a fantastic individual, phenomenal chiropractor, and really a thought leader in the profession, Dr. Stefan Vossen, with us. He set up core clinics in 2009, and he's grown it to a multidisciplinary wellness practice with over 30 staff. His interests are in complex chronic pain, sports injuries, and sports injuries prevention. And I don't know how he finds the time for this, but he is a father of 6, but he likes to escape to the fishing lake whenever he gets some time. So Stefan, welcome to the show. Thank you ever so much for joining us today.
Thank you for having me on, Tom. It's an absolute pleasure.
So,
and it's father of 5. The 6th one I inherited, and so that one I just paid for, but I claim my own because he's going to start studying as a chiropractor now. So I'm claiming him.
Well, you've had a wonderful influence on his life, I'm sure, and you're going to have an influence on a lot of other people's lives today, because we had a chat last week ahead of this show, and I got really excited for today. And I've been buzzing. I've been trying to push through my meetings this morning as fast as I can to get to today. So let's just hit the ground running. You run a multidisciplinary practice, and my question to you is, why a multidisciplinary approach?
Right. So basically, it's a mixture of 2 things. One is the fact that I try to be as efficient with my own skill sets as possible. So that's one of the central tenets. And the second one being my interpretation of what I understand to be the chiropractic promise. And I believe that the chiropractic promise has always been the idea of reestablishing a health enabling status in the individual by virtue of normalizing, whether it's mental aspects, physical aspects, nutritional aspects of a person's totality. You can add into that spiritual aspects, you can add into that sociodynamic aspects, etc., etc. And that's what I fell in love with chiropractic for. And I had the huge luxury of growing up with a lot of chiropractors in my family. There's probably about a dozen chiropractors, throw in a handful of osteopaths, some physios, some orthopedic consultants, mum and dad, GP and nurse. So there's a lot of healthcare influence in my family. And when I had my uncles explain to me their own versions, each of them, their own versions of what the chiropractic promise was and what attracted them to it, it was that understanding that as chiropractors, we are looking to identify that which disables a person's return to a normal health status, whatever that may be. And then I kind of pondered on that, and I started to think, okay, so what does that mean to me in practical terms? If I want to do that well, then it means that I need to become a really good adjuster. I need to become a really good counselor psychologist. I need to become a really good nutritionist. I need to become a really good sports therapist, physio rehab therapist. And I have to become somebody who can, in order to protect my profession, I need to become somebody who is a really good diagnostician. And I mean protect in the sense that I need to make sure that I pick the battles I can win. And in doing that, achieve a greater level of success, which will then respect my profession. And so in the sense that sometimes I feel that if we skip the process of safeguarding the patient and identifying, making sure that this patient is actually appropriate for care, that could be damaging to our profession if we omit to do that.
And I suppose my interesting question there, if you and I know what you're going to go on to, and talk about using your particular skill sets, but is there, I'm just intrigued as the question comes up immediately, because I know some of the audience will be thinking this, is there anything that you wouldn't advise to a patient to restore them to the capacity to heal and the capacity for health?
Never. But the point is pathway. So if I have a patient, let's, for example, a couple of months back, I had a patient walks in, had a scissoring gait, tried to convince me that he had sciatica. He went to see his GP, told him that he had sciatica, go and see a chiropractor. Okay, so we've got this whole narrative that exists between the patient and the GP, and then the GP and their perception of what chiropractic is, and that was to treat back pain and sciatica. Right? Patient comes in, problem started after he stepped off a bus, felt a little crack in the upper thorax. Things just didn't add up neurologically. Sent him off to the neurosurgical department at our local university hospital. And indeed, he had a complete collapse of T8, which was secondary mets due to prostate cancer. Now, if you don't pick that stuff up and you go and manipulate in an area where he is sore, where there is inflammation, where there is, you could put a neurocolometer on this, you will get a reading, etc., because you got additional blood flow, you got all this reactive muscle spasm, and so on and so on. Imagine as a chiropractor what the headline will be on the Daily Mail tomorrow, right?
No, I agree.
The fact that the GP completely missed this was irrelevant, and in fact, you could almost forgive it because, quite frankly, it's not their area of specialty. And actually, the fact that he decided to say you need to go and see a chiropractor is fantastic. That's a massive evolution on when I first started in practice in 2003, when the going motto was that we're the next best thing since witch doctors.
Yeah.
So the narrative has changed dramatically, and in a way, I took that as a compliment. But what I'm saying is, if I was not an able diagnostician who could at least pick up that something didn't stack up, right? I didn't diagnose the fact that he had secondary mets. I just diagnosed that there was something not right in the posterior thalamic tract, and that there were motion disorders coming from that. So after that, it became a case of refer out, neurology, spoke to them. I happen to know the people that run it very, very well, and it was immediately taken care of. That act safeguarded our profession.
Yeah,
that's why I'm saying that fifth bit about the diagnostics.
I agree. I think diagnostics is a huge thing, but if you look back to the origins of chiropractic, it was a huge thing as well. Unfortunately, it's just become palpation and jump. And I'm a big advocate of X-ray in practice because there's so much stuff under there that you don't see, and that brings in other disciplines into the practice.
And so, sorry to jump into that, and that's really where, when you go into these 1, 2, 3, 4, 5, I've got to be a really good this, that, the next thing. Listen, I'm not the brightest guy in the world, but I'm fairly knowledgeable, and I just realized that for me personally, I couldn't embody all of those skill sets.
Yeah,
I didn't have the time to study it. I didn't have the will to study it because some of it really just doesn't interest me. But I still respected the fact that it was relevant. Making the observation that something is not interesting to me means that I immediately have to pull somebody in who has the skill sets if it is relevant. And that's what multidisciplinary teams really are about. I'm not skilled at this, you are, but I'm interested in it. It's relevant.
Yeah, and I think a lot of people, like you've just said, so, that in that case you gave could have been missed. It could have been missed because someone's trying to balance too many plates, and getting caught in a bit of overwhelm. For instance, people, if you run your own practice, there's so much more than just the person in front of you. And it's the same as building a business. If you're building a business, then you hire the people who fill the void of your skill set.
Yeah.
And so you can focus on your genius. And it's the same for your practice. So tell me how your practice runs. How does it work?
And just to get back to that, and ultimately that is really the core tenet of what is a multidisciplinary team. It's how do you complement me? How can you make my process better? Or I think it was Tom Cruise, wasn't it, who said, "You make me whole," or "You complete me." That was multidisciplinary teams are a relationship where people complete one another, and to the benefit of the patient, and that's why I find it so interesting. But one of the other things that you got to seriously consider, and that goes into your question about the processes and how it runs, is that is a narrative, that's a discussion that is relevant, but only when it is relevant. Now, I'm stating the obvious here, but if you have a clinic that is, let's say, your marketing communication, your business communication, your strategies, your clinical strategies, and so on, are all geared towards acute care, let's say, then evaluating larger contexts like psychological impact, like dietary nutritional impact, may not be as relevant, because what you're dealing with is a scenario where somebody has a boo-boo, they tore a calf, they injured some calf, whatever it is, but that's injury care. I don't believe chiropractic is in that field. It's a complete waste of a chiropractor's time to walk into that field, which is where I then go round in a loop and kind of go, what are we doing as chiropractors in that field? Physios, sports therapists, all of those are doing a cracking job there. There's no need for that, and it's got nothing to do with the chiropractic promise.
It's true. It's because I think it's because chiropractors don't necessarily understand what they're doing, and I find this when I teach marketing is because you've got this complete separation between the sales team and the service provider.
Yeah.
Essentially, you're telling the public that you can give a quick fix, but you want people to stay for a lifetime. It's like this total disconnect, and I think it comes down to the chiropractor's understanding of, like you say, the promise and what they're really there to provide.
I think is that principle cognitive bias, not cognitive bias, cognitive dissonance between what people will say and what they actually emote, what they actually feel. And I think that one of the reasons for that to even exist is because people just don't actually know what the chiropractic promise is. Now, I have to say, just on that point, I'm only giving you my interpretation of it, right? So I don't know what the chiropractic promise is. I can only tell you what my interpretation, my understanding, my feeling, my emotions around what I interpreted the chiropractic promise to be as it was delivered to me back when I was 13, 14 years of age, by a limited number of people, i.e. my family, who looked like they were really enjoying their practices, who were doing well commercially, financially, but more importantly still, who were just fantastic, emotionally speaking, energetically speaking, fantastic human beings. And that inspired me to go, do you know what? There's something in that. That view, that interpretation, that way of looking at the world is beaming light off you. I like that. I'm going to get some of that. And it's basically that's what drew me into that story, that version of it. I appreciate that other people have another version of it. I might not agree with it. We can still have a discussion about it. If you're not able or unwilling to have a discussion about it, then that's a shame. But it is what it is.
I think that's one of the big downfalls of the profession is a lot of people who listen to this podcast who aren't chiropractors, who aren't in the profession. And there is an unwillingness to discuss within the profession as to different people's standpoints. You put their flag in the sand and then just stay there and turn their back on everything else. And discussion is important.
I think that's quite what's the word? I think that's quite symptomatic of that, again, that cognitive dissonance. Yeah. I think if you, for example, I gave a talk somewhere on YouTube about a decade ago, maybe more, at AECC, and I was talking about subluxations, right? Chiropractic subluxations, and it was, to me, it was hilarious because there was the gasp in that room to the usage of the word, right? Okay, again, it's a decade ago, so things are changing. People are actually starting to understand things slightly differently. But my point was that whether you want to call it subluxation, whatever you want to call it, let's call it a chiropractic subluxation for the integrity of the conversation here. And you say, okay, what is that definition of it? And you say, okay, the definition of it is anything that can impede on a person's ability to return to health. Right? We know that things that can impede on somebody's ability to return to health will be things like physical changes and adaptations, psychological changes and adaptations, and again, physiological changes and adaptations. So we've got this lovely triangle of health that everybody talks about. Marvelous. And as a chiropractor, I'm primarily concerned, or I'm getting trained to be primarily concerned. The conversation that I'm having is primarily concerned with, and the visuals, even down to the terminologies and the phraseologies that we use in our professions, they're all very spinal, vertebral, they're very mechanical. And in a way, that language is setting us up for a fall, because it's making us lose sight of all the other aspects of the chiropractic promise.
Yeah.
And if anything, we've got to really quickly revisit the discussions that were being had 100 years ago, 120 years ago, to actually, but evolve them. Because yeah, okay, the language was outdated, the concepts were misnomers, there's lots of technical and anatomical and practical errors in a lot of what was said. But that's not the point. The point is your principle something that you can support and adhere to? The principle is the same. Nothing's changed. We just have to rethink the execution. And ultimately, the big chiropractic centers, and the big names that were having, thousands of visits a day and all the rest of it, they were hospitals with all of those services in-house, but they were chiropractor led. Because who is better placed to deliver this diagnostic process, this case management process, case manage the patient through it, emotionally, physically, all aspects of it? Who's better placed than a chiropractor? I don't, I speak to neurologists, I speak to orthopedists, they tell me all the same. There's no one that can do what we do.
Yeah, and I think it's the difference. It's our philosophy is that deductive approach, that we understand that the body has potential, and we give it way more credit than if you come from an inductive approach where you've got a problem here, so let's fix it.
Yeah,
it's very, very different. And to be able to lead a case is that sort of visionary approach to see it, which you're absolutely right. And chiropractors are well placed to understand and foresee.
I think both educationally and purely pragmatically, from a point of view of we have a language, we have a patient encounter that can really manage all of those aspects incredibly well, better than any other profession I can think of.
And I think,
and that's, sorry, go for it.
So I was going to say, I think the problem comes here where people get confused is that they feel that chiropractors should do all of that, or they try to account for lack of confidence in their skill set by trying to do more than what is really supposed to be their skill set. And unfortunately, some of the colleges and institutions have drawn away from providing that skill set for the people, which is, the hand for my understanding, the hands-on, the adjustment, the working with that person, and then allowing the others to do the other things.
I think the capital error is not institutional. It's not academic. I think it's profession-wide. And I think that the error lays in the fact that we need chiropractors on the ground to deliver care that patients need. And in doing that, we realize that actually I can only give you an aspect of that skill set that you will work your entire life towards achieving. And that aspect is, it's like I'm giving you the steering wheel of the car that you're going to build over the next 40 years in clinic. And with that steering wheel, you can go around the road, walk the streets, and go vroom, vroom, vroom. And you can start collecting parts. And I think we are not clear or honest. I think it's both. I think we're both confused and dishonest as a profession. And to be honest with you, I'm picking on my own, but I have conversation with all healthcare professions, and they're all saying the same thing, by the way, of their own, right? Not of us, of their own. And that is that we're both confused and dishonest about what our path actually is. And you graduate, you finish uni, and what is your primary skill set? Diagnostics, spinal manipulation, and rehab. So you believe that is what you're going to be doing for the next 40 years. So then for the next 5 years, you do that. And then suddenly you find yourself 5 years in practicing and go, why am I not getting the results that I'm supposed to be getting, right? What's going on here? And then you start reading the research, and you because you're trying to be clever clogs here, and you try to make yourself feel better, so you start reading heavyweight papers with impressive titles, and you become depressed because you kind of go, well, that thing that I thought works doesn't work, that thing that I thought works doesn't work, that thing that but then you basically go into a state of paralysis, and that's where one of the discussions around the evidence-based side of things, or evidence-informed side of things, it becomes really relevant, because we're killing our young with some of that, because we're not actually explaining what the true narrative is. You're going to graduate with a limited skill set, and then you're going to spend the next 5 years acquiring additional skill sets in psychological counseling techniques. You're going to speak with podiatrists to acquire some information on gait function, movement patterns, movement pattern rehabilitation, some occupational therapy stuff. You've got to start looking at PTSD. You've got to start understanding EMDR. You've got to start looking at all these different components. You've got a patient with global pain, that's probably ME, fibromyalgia. You'd better start understanding what that is. What is the impact of gluten-free diets on those things, reducing alcohol? What is the impact of things like CBD or cannabis as a medicinal cannabis within the management of those kind of cases, etc. And all of a sudden you start to go, do you know what? I'm the shit here. I know all this stuff. So you're now 5 years in practice. You've been reading every book under the sun. You've followed every course under the sun. And 5 years down the line, you kind of go, do you know what? I'm ready to be a case manager now, because this patient that comes in, I'm going to adjust you, but I'm also going to be sending you to the podiatrist. I'm going to adjust you, but you also need to work with a counselor, and you just need to work with a nutritionist, dietitian. And those people will all write great reviews about you. They will all be sending everyone they know to you, because you manage their case efficiently, timely, cost effectively, and all of those things that matter to the marketplace. Because of course, we're stuck in this dichotomy between what am I as a clinician and what does the marketplace need me to be. You know, and I find that a lot of the time I have conversation with colleagues out in the field, and they're actually sacrificing what they can be, where their potential is, where they're in a way their mission is, as I see it, for what they perceive the market wants. I'm like, dude, don't be a bitch to the market. You're offering something that the market doesn't know it needs.
Well, I think that's a problem with what a lot of people are sold on, is like, do this and grow your practice quickly.
Yeah.
And it's like, no, that doesn't really work. And like, for some people, they're in their practice and they adjust, and that's what they do. And they don't have a multidisciplinary team. And being a case manager doesn't necessarily mean that you have to get them in-house.
No.
But if you decide on the people that come through, you allow people to leave the practice or let them go to somebody else who will serve them better, you will grow a much richer, a much deeper, and a much more sustainable long-term practice, serving the people who need your skill set, which you actually said.
And you will enjoy it, and you will love it. And instead of investing, because you see, this is a bit of a weird one, but one of my observations, I don't know what you've seen now, but one of my observations is between 10 and 15 years down practice, people start getting a bit jaded, because they went down a particular path for the last 10, 15 years, and they can't see themselves make a change in direction. It's working for them. It's getting them an income. It's comfortable. They've lodged it into various boxes in their head, and it's okay. And they've developed certain compensation mechanisms in order to deal with some of the grind of those boxes that don't quite fit, but they kind of ram them in there, and they're tolerating. And instead of investing in themselves and investing in their ability to grow the clinic, in their ability to guide and lead, and be a missionary of that promise, they start investing in other things, properties, businesses, whatever, stock, shareholder option. I've only ever invested in one thing, and that's myself. To the point of almost thinking, am I being selfish? Am I being an idiot here? But you know what, when you do that and you're making sure that, you know, when there is a box that doesn't quite slide, let's have a look at that. Let's pull that out. Let's take a couple of months back. Let's pull that box out. I know it might cost me a couple of months worth, but I need to know where that friction is in that box, and I need to know why it doesn't fit, and I need to put people in place that make it fit. And that's where the value of team again comes in, you know, because it's not just about skill sets. When you're looking at multidisciplinary teams, it's not just about skill sets, it's also about flavors. So by which I mean we look at, when I build teams, I look at skill and flavor primarily. So I can have two people that are great adjusters, but one has a very let's call it soft, emotionally empathic feel and identity, and the other one is very mechanical and almost reductionist in a way. People like different flavors, and as long as they get adjusted when they need adjusting, I don't care. As long as you are with the flavor that you match with, you will get a better outcome. Not per se because the flavor in and of itself does a huge amount, although it does obviously from a placebo point of view, but also from a, do I want to listen to this person? Do I identify with this person's flavor? We get so obsessed about our skill sets that we forget about our flavor.
Well, Fred Barge said he heals in the doctor who he trusts the most, to paraphrase it completely, you know.
Absolutely.
It's so true. And the other thing you're talking about with that is you're saying this sort of barrier to growth with people. What's the saying? I think Sid said it. Comfort comes as a guest, it lingers as a host, and it stays to enslave us.
Yes.
Comfort comes as a guest, lingers as a host, and stays to enslave us. And it's so true. Like, you get comfortable in practice, you got a nice house, you got a car, you got a mortgage, it's like, but are you really fulfilled in what you're doing? And are you actually, you know, achieving what you could for yourself and for these people?
And right there, that encapsulates this whole issue around confusion and untruth. We carry a lot of untruth in our profession, where we are telling ourselves and others that we are satisfied, that we are happy, that we are feeling comfortable with this, that, and the next thing, and it's just not true. You can tell. You know, you're like, okay, so if you could do that, you wouldn't do it. I said, no, I would, but I can't. Okay, so do you see where you lied there? You weren't aware of it, so it wasn't a conscious lie, but it was your subconscious was telling you to shut up, don't open that box because it's going to get too difficult, because it means that you have to acknowledge that you made some wrong choices 5, 10, 15 years ago. Now, again, you know, I say wrong. There's no right or wrong.
It's learning.
But also it's a pool, right? So I feed off experiences that other clinics have. I feed off choices that other people have made to create an ecosphere where there is variation. My practice has a flavor, right, as a whole, and that might not suit some people. And that might be down to price tag. It might be down to, it's a big old building in the countryside. It might be down to access. It might be down to intimidation. I don't know. I don't know what I don't know. You know, so there's space for all types of flavors of practices, etc. But I think that the key point here is, whatever your flavor is, have integrity about it. And be honest about what it is that you're actually presenting. And I think that both, you know, if we were to simplistically divide the profession into two groups, which I don't think is the case, but just for argument's sake, we were to say, on the one hand, you have them vitalists and UCA, SCA members, and on the other hand, you've got the evidence-based BCA members. By the way, boys and girls, that's completely incorrect, because there's a whole heap of washout. that is the narrative that seems to have impregnated the professional subconscious, but it's just not true. And if we say that was the divide, there's plenty, you know, positives and negatives in both camps. And I kind of look at it and go, do you know what? Can we just have an honest conversation for 5 minutes where we leave all the bullshit at the door, and we actually go, okay, what do I spend most of my time doing? I spend most of my time addressing people who come into my office because they're in pain. That's their first primary motivator to knock on your door. Whether you're the most vitalistic chiropractor in the world or not, most of those people are picking up the phone or searching on the internet because they've got a pain somewhere.
Mm-hmm.
And they bumped into you either because they asked about you, or they asked a friend that uses you, or because you came up high on Google or whichever other search tool that the patient was using. And that's the reality for what, 95, 99, 99.9% of inquiries. What happens after that, that's the discussion. Because you can then go, okay, you came in with a boo-boo, I'll treat you boo-boo. Or you can say, how long have you had that boo-boo for? 3 years. Okay. And it's not recovered by itself. And you've seen physiotherapists and you've done this, that, and the next thing. What is the mechanism, do you think, that might be meaning that this person 3 years down the line still hasn't recovered from that injury? There's got to be something that means that they're not repairing as quickly as they damaged it. So that means there's an imbalance between the damage rate and the repair rate. Let's try and find out what it is that causes that imbalance. And now you're having a chiropractic conversation.
Mm.
But if you go, oh, there's a tear there, let's whack some shockwave of some ultrasound on it. Yeah, no, we're having the wrong conversation here.
Yeah. And I think a lot of that comes back to, you talk about the evidence, and you take the evidence side of things as well, where if you just went by evidence base, then you might chuck that stuff on it.
Yeah.
And having the wrong conversation. And I think there's no greater evidence than our own meandering experience, and what we've seen over time. I mean, what was the BMJ put that amazing study out in, I think it was 2009, maybe 2008, where they did a randomized controlled trial between using a parachute and not using a parachute to see whether you'd actually land safely. And it's like, come on, if we lean too much to the evidence, we just get our head up our ass and don't serve the people.
But also you damage your own profession and your own reputation, because actually your failure to adequately assess the situation and decide whether or not there are other predisposing factors will mean that this patient comes in, you treat them with the evidence base, they feel slightly better, and then they're worse again 6 weeks later.
Mm.
And you will then use the evidence that they didn't come back again as meaning they got better and that's it. And you tell yourself these cognitive bias things all the time, just to try and reassure yourself that you're doing the right thing. And here we are as a profession with zero data on actually how efficacious we are as an environment in which that we do exactly that, where we actually find out whether there were predisposing factors to this person's inability to heal. So whether I'm adjusting an ankle, or whether I'm adjusting, C1, or whether I'm sending them to a counselor to deal with some, deeply seated PTSD issues, I'm adjusting that patient. That's what I've just done. By giving them access to the EMDR specialist, that was my adjustment, because that's their subluxation. Mm. And that's going to have more meaning and more effect and more benefit to that patient than any amount of spinal adjusting we could ever do.
But that comes back down to that initial conversation, doesn't it? That lack of evidence as to how people actually do aftercare is all down to your initial conversation. Only take the people on that are necessary or appropriate in your view and way of practicing for your care.
And that's then again where you get into, and this is just a decision I made. I in actual fact, for me, the very, very root of some of this was actually my discomfort with the idea of working in a field of healthcare that was highly self-limiting. So the idea of somebody coming in with an injury that looks like it will recover in 4 to 6 weeks, and they've had it for a week, and for me to then treat it for 2 or 3 weeks, for that patient to then improve, I don't feel comfortable with that. I don't find meaning in that. All I've done there is maybe accelerated that person's recovery by a week or 2. That is not a useful usage of their time and money to me. Whereas what I was comfortable with was the idea of, okay, you've been to 2 or 3 clinics, you've done different things, it's been going on for more than 6 months. If I now do something and in 3 weeks, 4 weeks time, those issues start to improve, then I've almost declared to myself and convinced myself that I have worth. And that makes me feel fuzzy and warm on the inside, because I feel meaningful in that context. Whereas in the other context, I don't feel meaningful. Or as Voltaire used to say, the doctor is the man that stands in the area in your vicinity whilst nature does the healing. It's like what entertains the patient. Sorry, the doctor entertains the patient while nature does the healing. And absolutely bang on. I don't want to be part of that, because I want to be able to say to that patient, you know what, I can't find anything that relates to your complaint that means that I don't believe that this will be better by itself within the next 3 weeks.
So talk to me, interestingly, on that note, like chiropractic, the overlying premises of philosophy, science, and art of all things natural, sort of natural approach to health. And like you've just said there, the doctor stands by when nature does the healing. What about people who come in proactively, who don't have pain, who just want to perform optimally? Are you going to adjust? Are you going to assess their spine, adjust them when necessary? Or are you going to say, let nature take care? What's your approach on that one?
It's the same principle. So the two areas that I have a real love and passion for couldn't be further removed from each other, but they're actually one and the same thing. It's chronic complex care and it's injury prevention. So my team and I would basically run one of the biggest, if not the biggest, sports clinic in the UK. And it looks so funny as a combination of things, because on the one hand, you have these super fit Premiership players, Olympians, all the rest of it. And on the other hand, you have these people that have suffered for 6 years, are on opioids, are chronic depressive, have loads of comorbidity issues. And they sit in the same waiting room. And people try to make sense of that. And they go, how is that the same thing? Absolutely is. Because all I'm doing to prevent injury is I'm looking at the same things. I'm looking at their mechanics, I'm looking at their nutrition, I'm looking at their psychology. And I'm providing them with what is needed to address any of the issues. Now, you've got to make one very important distinction here. And that is that in the athlete, doing that has value. In the general public, they don't perceive that value. It has value in them too, but they don't perceive it, right? So where you have an athlete where getting them to play an extra 3 games in a season, this is a real life example, meant the difference between losing a contract and going up to 25 grand a week. Yeah, in that scenario, drilling down and down and down and down to the very basics of any aspects of their mechanics, their nutrition, their psychology, it has value. Those boys and girls never complained because it added so much time, professional, career, commercial value to them. The reality is that it is not perceived to be as value for the general public, because the difference between playing those 2 or 3 games or being able to go to the gym once more in the general public would be unnoticed. It wouldn't carry a perceived value to them. To you and I, we know that it has value because we're looking at maximizing human potential. But the problem is that we can tell them that, and we can inform them and educate them about that, and we should and we must educate and inform them about that. But that doesn't mean that it is of interest or value to them. And we cannot be judges of that. I struggle sometimes when I'm talking to some of our peers who will be saying, the patient is non-compliant, or the patient is not interested in maximizing their health. It's like, well, why are you being so judgmental? That's their choice. You have no right on saying that somehow they should. All you have the right to do as a servant to the public is to say, these are your options. Do as you must.
I think that's really interesting. I just want to jump in there quickly, because you said as a servant to the public. We do forget that we are in service of the public.
Yeah,
And I think that we are of service to people. I think we become servants. And I distinguish between being of service and a servant, as the servant being more submissive, is when we're not in our genius and actually practicing what we do. Like you said at the very start of when we started discussing, trying to do everything, you become that servant to everybody. Whereas you allow yourself to be of service, you provide that person with an opportunity, and it's their choice as to what they want to do.
And I've had it many times, that somebody walks in and asks for my view, my opinions, my interpretations, and I'll go, listen, this is my series of observations. This is the opinion that I've derived from that. These are the options that come out of it. If you were my wife, I would get you to do this, but it's entirely up to you. And if you've educated, etc., then they may make that choice. They might not, because what we don't know is those things that we don't know. We don't know what their financial status is. We don't know what their psychological. They might just be dipping the toe in and trying to see whether they are in a place at that moment in time to actually address some of their key issues, and they might bounce off. And then 2, 3, 5 years later, they come back and go, now I'm ready. Yeah. But you know what? You were the person that planted that seed. Over the following 2, 3 years, 5 years, it grew. And it then created a motive and a motivation to address some of the issues that they were impaired by. And that's really complex, that again, I've stopped trying to control things.
Well, that comes right back to BJ's quote. Like, you never know how far reaching something you may think say or do will affect the lives of millions tomorrow. And then trust the process.
Yeah.
And
this is the thing. We don't get taught these things. I mean, again, I was very, very fortunate because I've been spending my time in some of the best chiropractic offices since my early teens. So I've had a huge advantage of feeling that, of seeing that, even if I didn't understand what was being done technically and from a skill set perspective point of view, but I felt it. I could hear the language. I could observe the dynamics of how that was delivered well for that time. And obviously things have evolved, and we have progressed in our I was going to say love language, but care language, and we, as a society, I mean, one of the things that hugely attracted me to working in England, because I'm Belgian originally, one of the things that attracted me tremendously was the fact that the love language in this country is so poor that it really was a huge opportunity to have a significant impact as an individual, and again, that made me feel warm and fuzzy on the inside. Italians, Spaniards, Southern French, they have a much stronger policy of self-care than the British do. And I found that a phenomenally interesting, tantalizing challenge to become part of, which drove me even more to be very strict with everyone about the chiropractic mission, because there was too much of an invitation to bastardize it, and it's wrong. It's wrong.
You're absolutely right. And I certainly see a lot of the Eastern Europeans we take care of have a phenomenal commitment to their health.
Yeah.
Very, very different from the narrative in this country. I think, unfortunately, it's because of the free health service, the expectation of a fix. But it's nice to be able to provide an opportunity for people. And I suppose as we start to think about wrapping up the show, and I probably don't want to, I want to talk all day, but you're a busy man. And I suppose coming off that question or that comment, what do you think the potential is if everybody sort of started to adopt this approach? What do you think the potential is of our profession? If everyone started to think, along the lines of staying in their lane, doing what they're really skilled at, that case management, multidisciplinary, what is the potential?
So I think it's a question with a huge amount of implication. I think the potential is that of placing the chiropractic profession centrally to one of the biggest gaps in the healthcare market. And I know everybody tells me, oh, there's only 3,000 of us. It's like, okay, 3,000 case managers can look after 30 million people, easy. Because you're not treating them all. You're case managing, right? And so the fact that you are doing that has a number of offshoots. One, you deliver effective care. Everyone knows that if you have complex chronic conditions, you need an MDT. The research is barking at that. Everybody knows that that's where it's going. That's the only thing we know pretty much for sure, is that when you want to start getting results in the area that matters the most, you need an MDT. Now, I say matters the most because it affects people's lives the worst. It has the biggest cost to society, and it has the biggest cost to the individual. So that is a market, that's a part of the healthcare spectrum and the healthcare market that is completely unaddressed. And there's no one who seems to be willing or able to fill that void. And I couldn't think of a profession that is more well-skilled and well-placed to deliver on that than the chiropractic profession. So with those 3,000 chiropractors that all of a sudden all convert into MDTs and into case managers of MDTs, we will have probably the single biggest impact on the healthcare status of a nation within 5-10 years. Now, I find that exciting. Other people find that scary, right? There's nothing to be scared about because it's not complicated. It's not hard. It just means taking a little bit of a step back, slightly rethinking about who and what you are and what you want to be, and just putting it in place. For the first 6 years in my own clinic, actually for the first 12 years in practice, I was referring to local podiatrists, local massage therapists, local counselors, etc. The only reason I started taking them under my roof is because I wanted to control the quality of care. I wanted to control the narrative. I wanted to create unity in the pathways, and I wanted to make sure that the patient had a great experience. That's the only reason. But the opportunity has been left untapped for the last, I would say, particularly the last 40 years. Now, you could say 120 years, you could say 2,000 years, but that's not true because at various stages, healthcare has and health philosophies have tried to engage these learning opportunities, these self-knowledge, these self-insight opportunities around your mental health, around your physical health, around your nutritional health. But they just haven't succeeded to do it because the messaging was all over the shop, because you had these different professionals who would then make it about them. And to me, it feels that chiropractic today and for the last 30 years has been trying to make it about them. As a chiropractor, I'm not interested in making it about me. I'm interested in making it about my patient. And I'm interested in understanding what it is they need and giving them access to that, helping them gain access to what they need. And sometimes that is to be told to go home and that it'll all be fine by itself. Sometimes that can be a complex care pathway, and it can be anything in between. And I think the academic institutions are doing a phenomenal job of priming and prepping people to deliver on that. I just think that the profession, not the academic institutions, not the associations, not the whatever else is, the profession could do well with having that discussion and saying, hey, actually, that does sound like a lot more fun. And the status that comes with it in your community, your internal dialogue that comes with it, your joy, your pleasure, your reward mechanisms that come with it, for me personally, phenomenal. I can't think of anything I'd rather do than be in practice.
Well, I'm almost speechless. I'll be honest with you, Stefan. This has been one of my favorite shows that I've ever recorded, and it's been really great to just have an open and honest conversation, um,
I think that's what
and
we need
see
to
so
do.
much agreement and potential. I mean, I love the word potential. I love, you say some people get scared and you get excited. I certainly get excited by the potential of it. Um, if people want to find out more about you, where can they find out more about you?
I'm not that interesting. Call me. Um, wherever. I don't know where
Your
can.
core clinics, aren't you? Your practice is core clinics, and
Yeah, call clinic. Yeah, in Hatton. Yeah,
people can find.
and I would say that anyone that wants to see it in practice, so they can wrap their heads around it in the practical terms, is really welcome anytime. To come around and call me. I this is what I love and do. It's what I live and breathe. And again, there's nothing that I'd rather do than work as a clinician within that context or help other clinicians work in that context. There's nothing to be scared about. It's not at all what I think most people think it is. It's just pure joy.
Well, Stefan, thank you ever so much for taking your
Absolute
time to be
pleasure.
on the show. I really, really appreciate you being on here.
Awesome. And I'm really sorry. I've got to shoot. I've got another meeting that I'm actually 5 minutes late for, but I'd love to catch up. And again, if there's any other conversation you want to be having, it'll be an absolute pleasure.
Thank you ever so much. Thanks for joining us on the show.
Have a lovely weekend.
You too, mate. Take care.
Bye, everybody. Bye-bye.